In-office trigger release is a small procedure that we do in our tradition office. Once the tradition office opened in 2018, we had the foresight to create a little minor procedure room. And with that, we have the capacity of doing these small minor hand procedures that can be safely done with just local only, and at the convenience and at the tremendous cost savings of being performed in our clinic instead at a surgery center, or worse, at a hospital setting. A trigger finger is typically when there's pain along the palm or on this area here. And when the fingers go down, sometimes, but not all the times, they can have a hard time coming back up, and it will actually click and pop. And it'll be sore there. It can be very debilitating. It can affect people's ability to hold on to their morning coffee or grip tools and use their hands like they normally do. And so if the cortisone shot doesn't fix it, and that fixes it maybe a half the time, then I would recommend a trigger release. And since we do it in the office, it becomes very convenient and very accessible to the vast majority of my patients. The procedure surprisingly takes about 3 to 4 minutes. So there's just a little numbing agent that's applied to the hand at the base of whichever digit is being worked on. We let that set in for a few minutes, and then it's just a field prep. We prep out the hand. I have an assistant that keeps the patient nice and comfortable. And then a little tiny incision. The incision is probably about half an inch or so, or maybe like half an inch or a third of an inch. And about 3 to 4 minutes later, it's completely done. And then a couple of stitches and a soft dress, and the patient drives himself home, typically. Recovery time is pretty quick too, relatively speaking. The couple stitches come out in a week, and then patients are allowed to do whatever they want after about 3 to 4 weeks. For the first 3 to 4 weeks, I tell patients to maybe take it a little easier. There's no need to do heavy chores or heavy lifting. That'll just kind of stress the area, cause a little bit more pain and swelling, which we would try to avoid during the first few weeks, allow the body some time to recover. Since 2018, I've calculated we've done about 750 of these trigger finger releases safely done and effectively done in our clinic setting. We had no adverse effects, no major complications, no redos, no aborted procedures for any reasons whatsoever. And I think it's a kind of a testament to the service we provide here at SFO, that we provide a service that's high quality, of tremendous value, and it's efficient for the patient so they can get back to doing what they love doing, and let them get back to doing work and play and everything else in between.